How many of you, this is your first time to Prairie Health and Wellness? So good, quite a few. How did you hear about us, just out of curiosity? Friend, okay. Don't remember. Friend or Facebook, okay. We're always curious how the word gets out, so that's okay. Those of you who know me probably recognize I've got a little bit of winter growth. This is my no shave November, or as my wife calls it, no kiss November. I had to start mid-October because I grow a beard really slowly. So, well, tonight we're really excited. Autoimmune disease is something that we see a lot of in our clinic, and I think it's something that we'll probably see more of. That seems to be increasing. We all know more and more people that have autoimmune disease are getting diagnosed with possible autoimmune diseases. So we felt like tonight we would really touch on the basics. I think you could spend an entire year discussing the differences between each autoimmune disease and how it attacks the body and what effect that has on your overall health. We felt like it was probably more productive for us to talk about what's common between those diseases and what our initial approaches are before we start individualizing it with each patient. So my name's Dr. Jeff Davis. I'm the owner of Prairie Health and Wellness, and I have the distinct privilege of practicing with Dr. Kristen Marvin. She's our naturopathic doctor. I'm allopathic. If you guys don't know the terms, allopathic medicine, traditionally we use a lot of pills and stuff to fix things, and Kristen's naturopathic. She uses a lot of natural things to fix it. So Jolene Zivnuska, who's all the way in the back, is my nurse practitioner. Jolene and I described ourselves as retrofits. We're trying to practice more like Dr. Marvin. So we've all done advanced training in integrative and functional medicine, and that's kind of our approach in this clinic. Not to say that we don't use medications. We do believe there is a place for that, but we really try to look at diet, lifestyle, and natural approaches first. It's nice because there's fewer side effects. It's more compatible with almost everybody out there. Our clinic is a direct care clinic, so we don't contract with insurance companies. By doing that, we keep the costs low, and we really concentrate on what's most important, which is you. So if you have questions about that later, I'd be happy to answer those for you. This will be available on YouTube, so if you don't like taking notes and you just want to listen, you can go back and watch it later. So, all right, so basic approaches to autoimmune disease. I always struggle trying to find the pictures for the presentations, and so this time I just included some presentations from my son and I's hike that we did in Arkansas. So we hiked the Ozark Highlands Trail loop, which is supposed to be about a 13-mile loop, and we creatively made it into about a 22-mile loop because we're not really good at finding our way or following the signs on the correct path. But we had fun nonetheless. So this was a berry that we saw on the trail. It has absolutely nothing to do with the immune system, but I thought it was kind of pretty. So the immune system, it's the body's defense against organisms. Any of you recognize this game? You recognize this game. This is Space Invaders. I remember when this game came out. Played it in the mall. So my kids look at this and think it's ancient. It's funny to think that this is an antique now. But so the immune systems really are our immune systems. Very simply, the job that our immune system does is to recognize self and non-self. And it really, you could completely stop the lecture right there about the immune system. But there's a lot of finer points that we're going to talk about how the immune system recognizes self and how it recognizes non-self. So through a series of steps, our immune system develops, and we actually talk about to our pediatric patients how colds are normal, how your body needs to fight viruses, and by doing that, your immune system gets stronger. It gets better at recognizing self and gets better at recognizing non-self. So we were, I believe, designed to encounter these pathogens and have our immune system fight them off. And for the most part, our immune system wins. And all of you are sitting here as a testament to that because you didn't succumb to some illness when you were growing up. So these are the invaders, and the innate immune system is the one that we're born with, and being non-specific, it really is best at recognizing what is you, and it doesn't care where the non-you is, it just knows to attack that. and that we're born with. It happens when we're developing, usually in utero, and continues developing early in childhood. There's macrophages and dendritic cells, and we'll actually watch a video of how dendritic cells work. And we kind of struggled, Dr. Marvin and I did, when we started this lecture, because we really geek out on the details and the science, but we also realized that we would get people falling asleep if we went too deep into detail. So we can always answer questions afterwards and geek out as much as you want onto this stuff. Almost every tissue in our body has these immune cells, and they're always traveling around. If you want to really see some unique stuff, you can go on YouTube and look at videos of macrophages and what they do. But these things, they kind of move like putty, and when they encounter something that's foreign, they just wrap it up and eat it. And it's pretty amazing how that happens. So everybody has those. We have them in our skin. We have them in our mucosal lining. We have them in the gut. We have them in our lungs. They're everywhere. Once they're activated, they release a lot of signaling proteins, and cytokines is a generic name for that. And those signaling proteins go on and they recruit other parts of our immune system. And so that's one of the things that can happen that kind of triggers that inflammatory response that might be an accelerated allergic reaction, as these cytokines get a little bit out of control. So a cytokine that a lot of you guys are familiar with is histamine. We've all probably taken Benadryl before to suppress that particular cytokine response. Because it's nonspecific, healthy tissue can be caught up in the crossfire. And one thing that when I'm talking a lot about autoimmune disease, I like to use analogies, and I tell people that our immune system's a little bit like an army. We want to train it, but we also don't want our army to be in constant conflict. And when we're over in a war, there's lots of friendly fire. When we're at home training, there's very little friendly fire. And so I think that's a good example of how we don't really want our immune system to be at this heightened state all the time because of the friendly fire. So inflammation. I think this match does a good job of just kind of describing the inflammation. It is like fire, and it's like multiple parts of your body are on fire. It's a very broad term, and we have ways of measuring inflammation, looking at several different of those cytokines. But in general, it describes the actions of the innate immune system to trigger that inflammatory cascade. So whenever you have pain, swelling, redness, the Latin words for those are rubor, dolor, and calor. Those are all signs of inflammation. And any disease that ends in the word itis probably involves some inflammation. So adaptive immune system. This is the second immune system. It's the one that's a little bit more specific, and it remembers. It's able to respond much more quickly than the innate immune system. And this is why people can be exposed to something and not really have a reaction, but the second time they get exposed to it, they have a massive allergic reaction. So bee stings are a good example of that, poison ivy, things like that. Our body remembers and begins making these immune factors and stores them in things like B cells, and they're just like big gigantic balloons of histamine floating around waiting to be activated by their particular key that your body has a memory of. And it's a pretty slick system because it enables us to survive a cold, fight off the cold, and then the next time that cold virus comes in, boom, it's gone, it's kicked out. We have all these rapid immune responses, and for the most part, we probably don't even know it. We're constantly being assaulted by germs all day long. I have people who are really fanatical about washing their hands and keeping them clean, and that's a good idea for not passing germs back and forth, but don't be fooled. Your entire body is just filled with bacteria. You are a walking petri dish for the most part. And nor would we want to eliminate all of those things. That's where our immune system helps us determine what's dangerous and what's not. So it's responsible for recognizing those enemies and responding very quickly. And it does that with immunoglobulins. So those are produced by the B cells, and this is a 3D model of a protein that's been folded. And if you see these pictures in textbooks, it makes it look like this beautiful Y with different fragments on it. And it's not, nature isn't quite so symmetrical. So this is actually what that immunoglobulin looks like. And it's freely circulating. We measure these commonly in this clinic. We'll test for different immunoglobulins, especially if we're looking for autoimmunity and Hashimoto's. we might check for the immunoglobulins that are targeting thyroglobulin or thyroid peroxidase. So that's just one example, and that's a pretty common one that we check here. They can be produced at an amazing rate. I was actually shocked to learn that our body can produce these thousands per second. That seems just almost inconceivable that we would have the machinery to be able to put that into play. So there's 4 main classes of immunoglobulins. Let's see if I can get this to switch. Can you go to the next slide? So IgA, IgE, IgG, and IgM. So IgA is one that we find in mucosal areas, in our gut, in our respiratory tract, pretty much anywhere there's a mucosal lining, which is to say anywhere where there's moisture in skin. The main function is to prevent those pathogens from entering into the circulatory system. So they're sort of the first line of defense. And then IgE is one that binds to an allergen, and then it goes by and it binds to those cells that release histamine, the mast cells. And so when a mast cell is triggered, the histamine is released, and the IgE sort of helps it happen. I always remember IgE as sounding like a sneeze, ichu. And that's the really rapid response. So if someone has a peanut allergy, and if they came in contact with peanut and their throat swells, their airway closes, that's an IgE interaction. IgE antibodies also have a pretty short half-life, so we don't measure them quite as often as we measure some of the others. I think mine's out of sync. IgG provides the majority of the antibody-based immunity, and these are the only antibodies that can actually cross the placenta. And so the mother begins training her infant's immune system even before the baby is born, which is really slick. So IgG will last a little bit longer. This is also one that we will test when we're looking for food sensitivities. It tends to be one that we find on people that have delayed reaction, or you could have an IgG reaction that let's say you have a reaction to strawberries, and it's an IgG reaction to strawberries. Well, you could have strawberries on Monday, have no reaction. Tuesday, have no reaction. But by Wednesday, now these IgG antibodies have built up to a level that Thursday, when you have the strawberry, boom, you kind of overflow your system, and now you're having that allergic reaction. Those are tough to figure out, because if you try to go backwards and look through a diary, you would say, well, I had strawberries on Monday, Tuesday, Wednesday, so clearly the strawberries is not the cause. And strawberries really could be the cause. IgM is secreted in the early stages before there's enough IgG to go around, and it also interacts with our innate immune system to find those pathogens. IgM also tends to stay around longer. So our protective barriers. So we have the skin. That's our first and probably most evident protective barrier. It's not the largest, however. If you get a cut, obviously that's a source for infection. The gut is probably the one that we spend the most time on, because it is the largest interface with the outside world. When you look at the surface area of the gut, it's about the size of a tennis court, and that's in an adult. And it's only a single cell layer thick. So that's pretty amazing how much surface area we have on the inside of us. Blood-brain barrier is one that's really being studied a lot, because we've talked about that the blood-brain barrier is this impermeable fortress, and actually we're finding that it's not, and that people can have leaky brains just like they can have leaky guts. And we'll talk a little about leaky gut a little bit later. So the purpose of the gut is really to be that barrier, but to allow transport of nutrients into our circulation. And we want to transport the nutrients, not the food proteins. Our gut's supposed to break it down and just let the amino acids come through. Everything else we want to keep in the gut, especially the bacteria. So protective barrier, we have resonant immune system that's in our gut. It's probably our largest functioning immune system is in the gut. And they're going to recognize pathogens. We have bacteria that actually work for us to protect us. So these bacteria have grown up with us, and they really do. We call it the commensal human biome, and it's because they need to be there. In fact, we get really sick when we lose all the bacteria that are in our gut. There's a network of blood and lymphatic systems that are in there as well. Right. So if you click, it should play the video. we probably won't be able to hear it, so I will kind of narrate this. So this is an example of food going down the esophagus, and this is a really fancy 3D animation of it. Back when I was in med school, we just had the guy with his face turned to the side and a hole. That was it. You know, we didn't have any of this fancy visualization. So this is an example of that villus mucosa that's in the small bowel. And I do endoscopy, so I get to see this on a regular basis. And every time I see it, it just amazes me. Normally when I go in, the mucosa is pretty dry. I'll squirt some water in through the endoscope. And as soon as I do, these villi just pop up like sea anemones. And each one of those villi has thousands of microvilli on them. And then this is a Peyer's patch here. So that's a little pocket of immune cells. This is the Peyer's patch in a cross section. And here you can see the microvilli that's rising from the lamina propria. So villi. And this dense capillary network is how we absorb nutrients. They then go down into a mesenteric lymph node. This is one from a Peyer's patch lymph node. So these two will communicate. And then our lymphatics will then flow through the lamina propria, and then eventually we bring those nutrients into the liver where they're made into different products, formulated into, either the fats can go into chylomicrons, and the chylomicrons can be made into triglycerides and cholesterol. So this is now just the top of one of those microvilli. So each one of these enterocytes has thousands of microvilli on it. And then you can see here, these are actually our commensal bacteria floating around, and they're floating inside what's called it's sort of a slime layer that they create. And they create this nice protective environment. Some things can transport through these gates, and our immune system has a way to grab those and sort of sample it to make sure that everything's going along, acting normally. And this is a dendritic cell. It's really slick. These dendritic cells can sample the environment, so they just slide a little tube right up between cells. They're able to grab onto different antigens, to different particles floating around, and then bring them in, and then release those cytokines or those different really signaling proteins. And that's the way our immune system talks to various different parts. So they float around and interact with B cells and T cells. And in doing that, this is where we could really geek out for hours, but I'll spare you the details. Pretty amazing, though, that these T cells will then go on and interact with other cells, and then that's how we get the memory of of our immune system. So again, going back up and showing this area, sometimes this gets damaged. And it should so. It seemed like this video was a lot faster when we played it earlier. Well, we're taught these concepts, and in medical school, it's really hard to grasp what's going on. And I watched this video probably 10 times, and I was just like, this does such an amazing job of explaining what's going on. So here we've lost that protective layer, and now these microbes are actually coming in, and you can see that the tight junctions that normally exist between these cells are opening up. And so this now just sets off this inflammatory cascade. There's a lot of things that are bombarding the immune system that normally are floating around not causing a problem. Whether it's bacteria, it's microorganisms, viruses, food particles are getting in there. And so now the dendritic cells are going up and sampling things that they're not normally able to get access to and releasing a whole host of inflammatory. So this is one mechanism of how the gut-associated lymphoid tissue causes these immune reactions in our body. So people sometimes are confused, why do you keep talking about my gut? Why do you keep talking about probiotics and things like that? And it's really because this is the largest interaction we have with the outside world, and so we focus most of our attention in this area. I could watch this like 10 times, but let's go on to the next slide. So again, the gut-associated lymphoid tissue, this is what I grew up looking at, was these static slides, no fancy motion videos, and I had to sort of try to imagine what was happening. So autoimmune disease. What are the symptoms of autoimmunity? And they're really pretty broad. I mean, allergies, anxiety, depression. We see low blood pressure, sometimes high blood pressure. Fatigue is one that we see every day, people coming in with fatigue that they've had for years. And that's really a tough one because there's so many things that can cause all of these symptoms. And so in the back of our mind as we're listening, your practitioners are formulating a list of possibilities and then thinking of ways to kind of work their way through that particular decision tree. Rashes, another very common one we see. Digestive problems every day in this clinic. Weight loss. This is an incredibly common one. People will say they've tried everything to lose weight. And we really feel that weight is not a problem in and of itself, but probably a signal that there's something deeper going on, whether it's an imbalance in micronutrients or whether it's stress, whether it's an issue with cortisol, or it could be an issue with the immune system. And then susceptibility to infection. So disease examples, and this is where we really could talk about what the differences are in each of these diseases and how we approach them. And we do have some lectures where we talk specifically about Hashimoto's, and we'll have some lectures upcoming where we talk about different inflammatory bowel diseases. But rather than spend time going through what's different about each of these diseases. Now, celiac disease is one I do want to touch on a little bit because it's a great example of how the gut and our immune system interact. Vitiligo, I mean, the list was about...
That's the shortened version.
Yeah, there is probably 150 of ones that we know are autoimmune, and then there was a list of probably 300 diseases that we think are autoimmune. So we're still trying to kind of decide what's going on. So it goes on, endometriosis, pandas, all of that stuff. So what causes this autoimmunity? This is the picture of us, again, on our hike. You don't have to stick in the pictures. I just thought, yeah, this is a little pond that we... Have you guys been to Arkansas before, anybody? This is like the nation's best kept secret. I mean, the hiking, the waterfalls, the creeks that are back there in the woods, it was beautiful. Okay. So 3 major factors that cause autoimmune disease. This is a nice Venn diagram kind of showing how it's not just one thing. You can't just point to your parents and blame them, right? We'd love to be able to say it's genetics. My mom had it, my grandma had it. And certainly that plays a big role, but also the immune regulation. So whether we come in contact with a disease or a toxin or something that triggers that immune response. And then also our environment. So what kind of foods you eat, that's a huge player in autoimmunity, and probably the one that we spend the most time focusing on is the environment. The genes we can't change. Your parents are who they are. You can't choose them. The immune regulation is usually something that happened in the past, and so we're left with dealing with the environmental effects. So there's again, lots of different genes, and we do some gene testing in our clinic. It does give us some ideas of where we need to go from a therapeutic standpoint, but unfortunately, it's not like it is in the movies where you can just look at somebody's genetic thing and then say exactly what they're going to have. I can't look and tell whether my son's going to pass the SAT or make it into college by looking at his genetics. Mutations of these genes can increase our vulnerability. So again, that's what we're looking at, is those mutations to SNPs or single nucleotide polymorphisms. That does tend to run in families, like we said. But I also remind people that eating habits tend to run in families. We hear a lot of people say, well, diabetes is, everybody in my family has diabetes. And I say, well, everybody in your family probably eats biscuits and gravy for breakfast too. And they would nod their head and go, yeah, I think you're right. It's true. We did kind of pass that down. So there's a lot of things that get handed down that don't have anything to do with our genetics. And again, it's only about 1/3 of what we see with susceptibility. So environmental toxins. Dr. Marvin and I went to a conference where we learned about a lot of these toxicants and things that our body is interacting with. And it really, the whole weekend, we were just terrified because it just seems like our whole environment's trying to kill us. Again, it's go home and kiss your liver. It does amazing things for you. You should hug it and really be thankful for all the things. But there are things like heavy metals that are present in our environment. You know, a lot of us have heavy metals in our mouth, and every time we chew, we're releasing a little bit of mercury into our system. So those are things that can interact with the immune system. They can cause stress and strain, and when you add it all together, it's the straw that breaks the camel's back. A lot of prescription drugs increase autoimmune disease, and that list is very, very long. So these are some of the common ones. So 38 drugs just linked to lupus in people who are genetically susceptible. So again, that's one of the reasons we try not to use drugs when we can. Is lots of side effects to them, and our body really, doesn't recognize them for the most part. Silica dust, smoking, ultraviolet radiation, the sun, things like that. So being infected by certain pathogens can increase your chance of developing specific autoimmune diseases. Here we list a few of them. Borrelia is one that's associated with ticks, can lead to rheumatoid arthritis, sarcoidosis, schizophrenia, and other dementia disorders. Entovirus, chronic fatigue syndrome, type 1 diabetes, Guillain-Barré, also associated with that particular organism. And it doesn't mean necessarily that if you had Guillain-Barré, it was because of the entovirus, because again, association that doesn't equal causation. But like I said, when we look at a lot of these diseases, we see this common thread. Giardia, again, multiple sclerosis, ALS, Parkinson's, chronic fatigue shows up again, and then H. pylori. EBV is one that we see a lot of reactivated EBV in adults, and that can increase your susceptibility. So that's one of those environment, again, in that environment circle. And then probably the most important one is diet and lifestyle. So what are dietary factors that contribute? We talk about things that can decrease our nutrients, so anti-nutrients. Also dietary factors that can increase the intestinal permeability. So you'll hear us talk a lot about gut permeability and leaky gut. And then dietary factors that contribute to inflammation and the immune activation. Certain foods are just more inflammatory than others. So this is a picture of a cow that was sent to me by a patient of mine who's in Germany, and I had a virtual visit with her today to talk about her actual disease, which is Hashimoto's. And she said, do you want me to take pictures of we were on Skype, and she wanted to know if I wanted to carry the computer out to the field next to her and for her to show me how beautiful Germany was. And I was, of course, sitting in my office under fluorescent lights, and I said, no, that'll just depress me. So instead, she sent me a picture of a cow. This cow lives next to her. It's kind of neat. It looks like it has a little toupee on his head, and they're really furry. But all that to be said, eating a lot of dairy can... these dairy and grains that we eat can displace some of the other micronutrients, that we're getting from vegetables and fruit. And so certainly we do see a lot of people that without testing, we just say, go off of these things for now. And it's amazing how many people within weeks will just report back to us and go, oh my gosh, I feel 100% better. Fat-soluble vitamins. Our diets over the last 30 years, we've taught people to eat low-fat, low-cholesterol. And if you've been to any of our lectures before, you know that we don't teach that. We actually break all the rules, and we have you eat high-fat and low-carbohydrate. And one of the reasons is that these fat-soluble vitamins are really important. They need fat in our diet for us to be able to absorb them properly. And they're very potent in their ability to help our immune system. So intestinal permeability, again, grains, nuts, seeds, nightshades, all these contain substances that can increase the gut permeability and can damage the enterocyte. So again, the enterocyte is this little square cell here where all the microvilli, and remember this is just one villi out of billions that are in our gut. When that damage happens, there's a gap that opens up and it allows pathogens to come in. Some of the food that we eat can actually cause us to grow the wrong type of microbiome. So when we eat a lot of sugar, we tend to grow a lot of yeast. And so if you've ever made bread, that's what the yeast are eating. Beer, that's what they're eating. They're eating sugar. So it's another reason why we really focus on increasing the fats is we can decrease the carbohydrates, and sometimes we can decrease some of that yeast burden that's in the gut. This is a slide that I stole from Dr. Fasano's talk. So Alessio Fasano, thank you very much for allowing us to use this, although I didn't get permission, so he may be blocking this YouTube video. He did a lot of the research on zonulin. And so zonulin is a protein that when we eat gluten, it actually sits on a receptor here, and that receptor goes inside the cell and makes a protein called zonulin. Zonulin then comes out and loosens these tight junctions. So one of the things we do, that's one reason we don't do a lot of gluten testing for patients, is we know that even if you don't have a reaction to gluten, gluten could potentially be a part of this problem, and it has to do a lot with zonulin. So there's a lot of controversy about gluten. I know gluten-free diets are kind of a fad thing right now. We there may be multiple reasons why people do better on a gluten-free diet. Probably the biggest one is that when you're gluten-free, you tend to be processed food-free. So again, that goes back to all those not good foods for us. So what about alcohol? Alcohol has some great effects. It can really help with your cholesterol, but for autoimmune disease, it probably does more harm than good. So for the first, at least for the first part of helping people with those diseases, we do like to stop alcohol consumption. Sugar, probably the biggest thing that we try to stop. The amount of sugar that we consume as Americans compared to our great-great-grandparents is hundreds of pounds per year more. And this really, if we went back to 1973 when we started telling people to eat low-fat, low-cholesterol, and if we had instead eat, low sugar, low carbohydrate, we would probably all be in a very different place with our health system today. So what does the sugar and refined carbohydrates in general, what do? The high blood sugar levels will increase reactive oxygen species, which are very inflammatory. And so that will, and actually insulin itself is a really inflammatory hormone that's secreted by our own pancreas in response to dietary intake of sugar and carbohydrates. And then there's pro-inflammatory omega-6s, and those are other foods that we eat in the American diet. We have probably 40 times the amount of omega-6 that we need. And so we do a lot of measuring of omega-6 and omega-3 fatty acids in the clinic. And I would say out of probably 100 people that we check, maybe one would have a naturally high omega-3 because we don't eat enough salmon, we don't eat enough of the omega-3 fatty acids. So examples of refined carbohydrates. Just go in your grocery store and walk down the aisles. That's all the refined carbohydrates, right? So we tell people skip the aisles and go around the outside for the most part. Omega-6 fatty acids, though, can be found in a lot of foods that we think are good. So almonds are a great example. I like pistachios, but those are higher in omega-6. And it's not that omega-6 fatty acids are bad by themselves. It's just we tend to have too much of them. We don't have a balance between the inflammatory and the anti-inflammatory. And inflammation is not a terrible thing. I mean, we need inflammation to heal our body. Just most of us are walking around with too much inflammatory factors. So when we talk about the prevalence of autoimmune disease, why does it happen more in women? A lot more in women, 78% more in women. The answer is we really don't know. We have some clues. We know that estrogen is something that stimulates certain components of the immune system. That's something that men don't have very much of. Pregnancy is a unique condition that happens only in women, thank goodness. And really with pregnancy, you have something called microchimerism. And you can see that if your innate immune system is there to protect you against things that are not you, well, growing a baby inside of you is something that's not you, but you don't want to attack that. So your immune system for females has an ability to modulate itself so that the pregnancy is preserved. And a lot of that has to do with the placental barrier and the amniotic sac. But the woman is able to sort of temporarily restrain her immune system. And sometimes that switch back can really trigger an autoimmune disease. This little waterfall that we found out on the trail. So what do the autoimmune diseases have in common? Intestinal permeability, again, leaky gut. A lot of people, I've heard lots of doctors say, well, I don't believe leaky gut exists. And when we do specific testing looking at how leaky the gut is, we can measure sorbitol and mannitol and find out how much leaks across this barrier, and we can actually measure that. And we do see quite a bit of it. Increase in intestinal permeability is well described in the literature. And for the most part, it's caused by dietary and lifestyle factors. There's probably some genetic predisposition, but again, there's not a whole lot we can do about the genetics of this problem. Leaky gut occurs when a group of endocytes are damaged, and we've shown a good video of that happening. These microscopic holes that are formed, which the contents of the gut leak through, and then the immune system is inappropriately activated and sort of revs things up. Gut dysbiosis is another cause. This is a very general term, dys being out of balance and biosis being life. So the flora in our gut, again, I talked about the yeast overgrowth. That's an example of dysbiosis. Too much sugar causes the yeast to grow more. You can also have a dysbiosis where you don't have enough beneficial bacteria, so taking antibiotics. Raise your hand if you've ever taken an antibiotic. So lots of us have. And nowadays we have kids that are being born not through the vaginal canal, they're being born by C-section, and their first encounter with bacteria is whatever's growing in the hospital that day. So we need these organisms. They need to live in our respiratory tract, they need to live in our mouth, the vagina, and all through the GI tract. They really do a lot for us. But we don't want them to be in the wrong place. You don't want them in your eye, things like that. So they can have profound effects on our digestion. SIBO, Dan, you've ever heard of SIBO before? Small intestinal bacterial overgrowth. So this is Dr. Marvin's favorite term. She can't get enough SIBO patients. So if you know somebody that has this problem, send them her way. No, we've been joking. We've been seeing this a lot in our clinic. And SIBO is 65% of people have been diagnosed with irritable bowel disease probably have SIBO. So there's a great lecture that Dr. Marvin did on our YouTube channel if you want to watch that. Appointment and testing. So here's some of the tests that we do. I'm not going to read through that list, but those are antibodies that we look for or can look for that give us a clue about what's happening with the immune system to see whether there's something that's out of whack. We do this comprehensive digestive stool analysis. My kids think it's really gross. We look at poop and pee all the time. So if you're a little squeamish talking about poop, we're probably not the right clinic for you. But here, this is kind of a nice overview. It shows the different things that we're looking at in this analysis. We're looking for possible infection, inflammation, insufficiency, so not enough good bacteria, and then looking for the imbalance. This is, again, Dr. Marvin's favorite was the SIBO testing. So with SIBO testing, what we're looking is for a product from bacteria in the small bowel. This particular product is hydrogen and methane, and so we have you drink lactulose, which is a sugar that you can't digest, but your bacteria can. And when they do, they produce a lot of gas. And that's fine if it happens in the colon because, it's just farting. Everybody's okay with that. But when it happens in the small bowel, the lumen is much smaller and it creates a lot of pain and discomfort. It can create diarrhea. And so we can actually test and measure how much hydrogen is being produced and get somewhat of an idea of where it's being produced, whether it's in the small intestine or whether it's where it should be, which is in the large intestine. This is probably the test we do most commonly. This is our food sensitivity testing. Here we're looking at 3 different of the immunoglobulins, IgG, IgA, and IgE. Again, the ones that we see most commonly are probably the IgG reactions. And this is the intestinal permeability report, again, looking at the lactulose mannitol recovery. So again, these are things that you shouldn't be able to absorb, and we look at the ratios between the things you should be able to absorb and things that should be passing right through you if you have a good gut barrier. So when the barrier is damaged, it leaks these molecules across, and we can detect that and look at those ratios to decide how leaky you are. Treatment approaches. So dietary recommendations. Again, we've kind of touched a little bit about that, and Heather's going to go into some detail at the end. I know most of you are here just to talk to Heather and listen to all her great recipes. So she's going to talk a little bit about the AIP approach, and AIP stands for Autoimmune Paleo. And there's a lot of information on the internet about this particular diet. You'll hear a lot of people talking about AIP. And so we do talk about this approach because it does a really good job of eliminating a lot of the inflammatory foods and a lot of foods that cause gut dysbiosis, a lot of foods that can cause inflammation. And it's a difficult one. If you've ever tried a paleo diet, autoimmune paleo is even more strict. But the good news is that we've had patients who've done really well in this diet, and they've been able to kind of customize it and add some of their favorite foods back in after a time. Favorite AIP guides, really probably would put Heather at the top of that list. Heather has a lot of personal experience with autoimmune disease and just has been a phenomenal resource for our patients in helping them with dietary needs. A lot of people will bring their kids in, and I'll find that they've got IgG reactions to milk and to eggs, and they look at me and go, well, that's all my kid eats. What am I going to do? And that's when I send an email to Heather and say, I'm going to introduce this wonderful person who's going to introduce you to some new food. And so Heather's great. We have some cards, I think, somewhere around here. We'll grab some. Paleo approach, Dr. Sauer Ballantyne. It's another one that has a really good blog. Probably the only one of maybe 3 blogs that I would really point people to. Paleo Mom. She's a PhD, so she actually does geek out about this stuff, and she's earned the ability to wear the white coat and talk about this in her own life and how her approach to it has really helped her. And then we have some cookbooks that we'll probably show later. So managing stress. Yeah, this one's a tough one. We are all stressed. Stress comes up from all directions. And so we really want to help people address that stress and start to identify areas where they can simplify. So.
Well, and how many times has your doctor told you to reduce stress, but they don't really tell you how?
How, yeah. And it's really different for everybody. I mean, there are times when, we have mothers who, are breastfeeding their 4th kid, and they've gone, if their 18-month-old is still breastfeeding and keeping them up all night long, and we say, well, guess what? Here's how you're going to reduce your stress. Stop breastfeeding. Start sleeping. Have dad wake up. So there's lots of different ways we try to address stress. Deep breathing, stretching during the day, even if it's just for a minute or 2. There's a great article that talked about getting kids outside and moving more, and their grades increased, their level of stress went down. So we all need to move more. Most of us sit in a chair all day long. So I try to get up and walk around our pond out there at least once a day. So make time to have fun. We all need to laugh and play more. I mean, I think there's so many things that we learn in kindergarten that we've just not kept with. I mean, like taking naps. Why don't we do that? I would love to have just close my door and bring me a little carpet out and take a nap on the floor. I guess I could do that, right? I'm the boss, right? Physical activity. You do not need to be a professional athlete. And we have a lot of great trainers that we use, but I tell people the first thing is just establish a habit. Just get up and move and do something you enjoy. If you really don't enjoy running, don't get up and do it every day. Do something that's gonna give you pleasure. Acceptance of current physical condition is important. So if you have knee pain, you may be better off on a bike. You may be better off in the pool. Start building slowly. If you haven't exercised in years, it's probably not the right time to start training for a half marathon. Examples of healthy physical activity: walking, swimming, yoga, Tai Chi. Has anybody ever done Tai Chi before? I know Kristen has, yeah. Tai Chi is neat. It's that sort of a martial art rhythmical movement involving a lot of balance and breathing. It's really neat. Gardening, playing with your kids and pets, hiking. So that was something that when Grayson and I did our hike, I had no cell coverage most of the time, and it was amazing. Dancing, weightlifting. So let's see, looking like an athlete or supermodel is not the goal of exercise. And this is something we talk about a lot in our weight management classes, is that we don't use exercise to lose weight. We don't use exercise really to make us look different. It's really about making us feel better. And I think that frees up people when they realize that their exercise is really something that they're supposed to gain enjoyment from, not something that's supposed to punish them. Optimizing the environment. See, I struggle with the pictures. This is supposed to be the boy in the bubble. He's completely optimized his environment. He's not being attacked by any germs or pathogens. So he has reduced all of his exposure. I'm not sure I would really call him healthy.
I think does look plastic.
Yeah, right. That's a good point. So
He does look a little stressed.
he looks a little bit stressed. I think this is from a movie. I haven't seen it, but anyway.
We could probably do, and we probably will be doing early next year, a lecture on environmental medicine and just different exposures and how they affect our health. So.
Yep. Supplementation can be an important component of what we're trying to do. A lot of times we give people specific micronutrients. We give them things that help with digestion. It would be wonderful if we could get all of these things from foods, and if we all had our own farm and we raised everything and we knew where our animals come from. We probably could do that, but unfortunately we live in a modern world of conveniences, and so sometimes we have gaps in those micronutrients. So we try to find those gaps and fill them. So medicine, Chris and I both love this quote: doctors give drugs of which they know little into bodies of which they know less, for diseases of which they know nothing at all. And I can say I've done that for years and probably continue to do that because there's just so much that we don't know about the body. And a lot of the medications that we use, I get asked, how does this work? And I have to be honest and say, we don't know. Occasionally medications are appropriate, and we do use them, especially in our SIBO protocol. We use antibiotics, and we use blood pressure medication. We use medication to help people with diabetes, but we don't make it our only approach. We really try to look at lifestyle, and we use those medications as specific tools to help us achieve an end.
I'm Heather. Nice to see all of you. He briefly mentioned the autoimmune paleo diet, and that's something that I have personal experience with. I have psoriatic arthritis, which was on one of the slides. It's an autoimmune disease that is linked to psoriasis. Some people have the psoriasis and the arthritis symptoms. I have only the arthritis symptoms, which is really rare, so I'm kind of a low percentile for people who have that disease. However, I have had success with the autoimmune paleo diet. I've also done a lot of food sensitivity tests. Through the clinic here, I've done a few, and that's a really good way to test your blood to see exactly what might be exacerbating some of your inflammation or exacerbating your autoimmune condition. And they can be a little bit pricey, and there's a little bit of skepticism involved in how accurate they are. So a really good way to find out if foods are affecting you and they're exacerbating your inflammation is to just do an elimination diet. And this AIP diet is really great. It's very similar to the paleo diet, as he said. However, the paleo diet allows for eggs and a little dairy. I don't know, dairy seems to be a gray area when it comes to paleo. Correct me if I'm wrong, but and they allow...
We tell people to eliminate dairy and just see, because it's, again,
yeah.
Most of the world can't tolerate dairy, and us being mostly of European descent here in the
Right.
United States, a lot of us can, but it's a good one to try to eliminate.
Yeah, I see a lot of food sensitivity results come across my screen that the doctors email me, and I don't think I've seen one that doesn't have dairy sensitivity on it, so it is very common. But anyway, the AIP diet is a little bit different from the paleo in that you cannot eat nightshades, which is difficult for some people because peppers really spice up our food. Nightshades are potatoes, tomatoes, all the peppers. Nuts and seeds are eliminated on the AIP diet, and that's something that's allowed in paleo. That's a difficult one for people too, because one of the great snacks on the paleo diet is just grab a handful of almonds. And I do think we all maybe tend to overdo it a little bit, and I noticed that when I started the AIP and nuts were out of my diet, I felt like I was dropping a little bit of weight, and I liked that. So nuts and seeds are not allowed. That makes it a little bit difficult. Your go-to oils for cooking are going to be coconut and avocado. If you want something creamy, you're going to have to love coconut, because coconut is allowed on the AIP diet, and avocado is also a good one to get that creaminess. But again, no nuts or seeds or nightshades, and that's pretty much the major difference between regular paleo diet and AIP. It is doable, and if it makes you feel better, it is absolutely worth it. And look at it as a temporary thing. You're going to eliminate all of these things that are probably or could be causing inflammation, and then when you bring them back in one by one, you can really tell how your body reacts. So it's an inexpensive, interesting way to just kind of experiment with this a little bit and see what could be hurting you or making you feel bad. And there are a million recipes out there. These are two of my favorite books. This one's the Auto Immune Paleo cookbook. This one is He Won't Know It's Paleo. This gal decided to cook AIP food for 6 months without telling her husband what kind of diet he was on, and he loved everything. And then she finally told him, and she has a blog, and this cookbook is fantastic. If you get on Pinterest and type AIP in the search box, your computer will blow up with AIP recipes. There are so many things that you can eat, and it's a fun challenge, and if it makes you feel better, it's absolutely worth it. And like I said, it's temporary. You can start bringing things in one by one, and see how your body reacts, but you do have to give it a few days every time you bring something in, and only one thing at a time. So the hummus over there had no beans in it. It was completely cauliflower. The spinach artichoke dip did not have any dairy in it, not even any coconut. It was kind of, its creaminess was from squash, from yellow squash, pureed together. The little cookies, there are all kinds of alternative flours out there if you want to make some baked goods. Those cookies were made with tiger nut flour. Now, some of these are a little bit obscure and you have to get on Amazon or something to order them, but it's kind of fun to have them stashed in your pantry for when you want a sweet treat. Tiger nuts are little tiny tubers that grow in the ground. The potato is a tuber. And they are the best form of resistant starch that you can probably find to put in your body. Yes?
Have you found those locally?
Yes. Green Acres and Whole Food Market have the tiger nuts, and you can snack on those. And resistant starch is something that's good. It feeds the good bacteria in your gut, so you want a little bit of resistant starch in your diet. And they're crunchy, and they're a little bit sweet and starchy, and they're delicious. They're good for snacking. I actually soak them and make tiger nut milk with them. I mix them with other nuts and seeds, and I do that. Tiger nut flour was also available at Green Acres. That's where I got it. You can make, again, Pinterest or Google tiger nut flour, and all kinds of recipes will come up, and it's really fun. So the cookies were made with tiger nut flour. There's also sweet potato flour, and I have butternut squash flour at home. Plantains are allowed on the AIP diet, and they are starchy and wonderful. You had plantain chips over there. Plantain flour also exists, and that's how I made the little tortillas that were served with the spinach artichoke dip. So there are all kinds of alternatives out there, and it's a fun and interesting experiment. And if it makes you feel better, or if a loved one is struggling with an autoimmune disorder, this is a really good approach to take. Does anybody have any questions? Yes.
What's in the pumpkin mix?
The pumpkin is just coconut milk and pumpkin pie spice and gelatin. You can buy powdered gelatin from grass-fed beef at most of the local health food stores, and it's really, really good for your gut, actually. And it's a wonderful way. You can use gelatin as an egg substitute, which works really well in a lot of these AIP recipes. You can actually make your own little gummies with gelatin. It's kind of cool, your own little fruit snacks. I've done a lot of experimenting with that too.